Joining us now is Andy Slavitt, former Biden administration White House senior advisor for COVID response, the author of Preventable, the inside story of how leadership failures, politics, and selfishness doomed the U.S. coronavirus response. Andy, good to see you. Leadership failures, politics, and selfishness continue to be detrimental to us. There are selfish people out there who are challenging those of us who are vaccinated. You're vaccinated. How do you address what's going on right now?
Well, look, I think as we sit here today, with 30% of adults not yet vaccinated, we have a highly contagious variant that is much more contagious than the 2020 variety of COVID. You can get COVID in about 5 minutes of exposure if you're not vaccinated. It's time for us to take seriously at the next set of measures. And I think those next set of measures include not just looking at the government, but having employers step up and say, time to be safe in our workplace. If you're going to come into our workplace and expose people who are going to expose their kids to COVID-19, you saw the story in Florida, it's time for you to demonstrate that you're not going to spread COVID either by getting vaccinated or by taking a regular and frequent.
And we saw last week, we saw that start to happen, right? New York State, the Department of Veterans Affairs, the state of California, and a number of companies that said we're going to do this. Some have said they're waiting for full approval of the vaccine, so it's not emergency use approval. But many have told me, including Francis Collins from the National Institutes of Health, he says there may be a legal decision, but generally speaking, everybody's in a position to do that now if they wanted to. All employers could do that now.
That's absolutely right. Two things are important. First of all, people who try to confuse emergency use authorization with experimental are either not telling you the truth or don't understand the truth. There's a very high standard to get something approved for emergency use authorization, and every former FDA official is going on record as saying as much. So, number one, there's no real distinction. That is a falsehood. Secondly, Dr. Collins is exactly correct. Employers don't need to wait. They can act now. They can act today. And I think if you're working for an employer, you might want to ask them why they're not guaranteeing your safety. If you frequent a business or go to a hospital, go to a doctor, you might want to ask them why they don't require vaccinations. Those kinds of questions will help push people along to take the step that I think they need to take.
So, Andy, you're an explainer. You and I have been talking for years. So I think that you would find it a reasonable exercise to explain to people who have legitimate vaccine hesitancy, either for cultural reasons or historic reasons or whatever the case is. But that's only half the problem in this country. There are people who can be talked to and cajoled and coaxed, and then there are people who are spouting BS all over the place about these vaccines. Some of them work in our healthcare establishment. Gabe Gutierrez did a story with 4 nurses in North Carolina. I don't know why they're nurses. If you distrust the healthcare system that much, do something else for a living.
Well, look, there is distrust of the healthcare system that has historically been earned. For not just for people of color, but for lots of people who feel left out by the medical establishment. And there's a lesson in this. But there are people who are trustworthy here. There are people who and if you are not sure if you should get vaccinated, go talk to trustworthy people. Don't go listen to someone on Facebook. Don't listen to a political person, whether it's myself or anybody else. Go talk to people who've been vaccinated. Go understand the safety that provides them. Go listen to what's good for you and your family. And I think that those are right decisions to make. Nobody should shame anybody who has questions about getting vaccinated. But by the same token, we've got a whole set of people who are immunocompromised, who are under 12. They don't have the choice to get protected. And so we need to not only as a society care about the people who have individual decisions to make, we have to care about those people that aren't in the room and don't get a voice.
Yeah, it's a wise way to think about it, Andy. Thanks very much for joining us tonight. Andy Slavitt is a former Biden administration White House senior advisor for COVID response. We appreciate your time tonight.